Now we are going to have our students introduce themselves. And so I need you guys to speak in the mic when you speak. Please come up, all of you up here. Give your name, what undergraduate or graduate program you graduated from, what year you are in your doctoral program, and your research area. Okay, thank you.
Okay, hi everyone, welcome. My name is Anna Dermention, and I'm a third-year PhD student. In my cohort, I was the only one BSN to PhD. Nursing was my second degree, but the second degree was a bachelor's too, and I decided if I could get into the PhD program, that would be great. I did have work experience. I was out in the field for 7 years. I worked in critical care, and then I was working in quality. I work at UCLA, so I have a full-time job. And just my research area is heart failure population. I'm looking at outcomes, looking at risk scores and the outcomes of these patients. But I could answer questions later. I just wanted to say, if you're thinking of the PhD journey, I highly recommend it. It's been rewarding. It's really something selfish that I feel like people do. I've gained so much out of it. It's really changed my perspective. It changes you. Really, you come in with ideas, but you get out with tons of other ideas, or what you thought was true, it's not true. So I highly recommend it. I've loved this process.
My name is Paula Belson. I'm actually not on your list because I just happened to be here today and saw everybody else and crashed. Also, just starting my third year, I got my bachelor's from here, UCLA School of Nursing, many years ago. You didn't say we had to say the year, right? Many years ago. And my master's at USC, I'm actually a nurse anesthetist, so I'm doing the APN to PhD program. And my research is in retinoblastoma patient population and quality of life. I work at Children's Hospital Los Angeles.
Yeah, hi everyone. My name is Sarah Aljefe Gonzalez, and I'm in the third year, my classmates. So I got my bachelor degree from Saudi Arabia in nursing, and my master degree in women's health nurse practitioner from Case Western University in Ohio State. I'm like Paula from APN to PhD track. And my research interest is, as Dr. Lee mentioned, about mammogram screening among women from ethnic minority, mainly Arab American women. And that's it.
Hi everyone, my name is Sherry Anzaldo. I am starting my 7th year in the program. I just advanced to candidacy last Friday. My undergraduate degree is from UCLA, and I majored in sociology, and I minored in gerontology. And I entered the master's entry program in nursing at UC San Francisco, and I minored in nursing education. I'm actually a pediatric nurse working at Children's Hospital Los Angeles in surgical admitting, which is under perioperative services, and I also have a background in pediatric medical surgical nursing and rehab nursing. And my dissertation is on Filipino-American parental beliefs and perceptions on managing care for a child with autism spectrum disorder. And right now I'm starting my IRB application.
Hello everyone, my name is Alan Crescencia. I am an APN to PhD. Also, I work at Children's, primarily in the perioperative recovery room nursing, and my phenomenon is pediatric emergence delirium and how it impacts the quality of work of nurses. I'm in my third year. We're all pretty much in the same cohort, and we adopted Cherie in our cohort too.
Good afternoon. My name is Dave Hansen, and I attended the information session that you're attending in 2014, and I'm just entering my third year in the PhD program. My BSN is from Indiana University. I went to school with Florence Nightingale, so that'll give you an idea of how old I am. My graduate degree is from Texas Christian, Go Horned Frogs. I'm an advanced practice nurse, adult health clinical nurse specialist, though I haven't been in APM for a long time. I'm the Chief Nursing Informatics Officer for Providence in the Los Angeles region. My focus in my research is looking at the relationship between the practice environment of nursing and nursing stress. There's a lot of research that shows that good practice environments produce happier, more engaged nurses, but there hasn't been anything to look at stress in nursing, and so that'll be my indicator. I'll be using the Occupational Stress Inventory tool, and my chair is Dr. Mary Ann Lewis. So I just would say from Anna, it's a tough program, but it prepares you, and there's a lot of support in the School of Nursing. A lot of people, all the way from Dr. Lee, who's the director of the program, to the faculty that you'll come across, to Rhonda, they all want you to succeed. So I would highly recommend it.
So I am hearing of a lot of advanced practice nurses. So what made you choose PhD versus DNP? And that's my biggest struggle right now.
I'll take it. Yeah. So I think it's a great question, and I think you can look at it multiple ways, but I felt like in my APM program that I already was doing the work of, I knew evidence-based practice, I knew how to evaluate the evidence, and I knew sort of how to guide folks around evidence-based practice. What I lacked was research skills. I never got research in my APM program, and so I really went into this wanting to learn the skills of being a nurse researcher. And so for me, I haven't wavered from that, and the program really does, it really teaches you to look at the lens of a researcher. And so for me, it was a no-brainer because I felt like I already had the DNP skills. I didn't feel like the DNP was gonna teach me anymore, and so it was really, I wanted to use my research skills. So that's my perspective.
And I was just at STTI International Nursing Research Congress this past July in Dublin, Ireland, and there's a discussion between DNP and PhD, and one of the thoughts that they want you to answer is which degree transcribes globally. So there is your question. I don't need to answer it for you, right? Because I think the DNP is good, but it's an American degree. And if you go globally, which one transcribed globally? That's what they were saying. So I just wanted to add that. Not that I'm downing down the DNP, but it's good for us here who really wants to do the clinical practice.
Yeah, and actually I think I came to this decision when I was at the research session 3 years ago, the information session, because I was sort of, going back and forth, and I initially thought I was going to do my DNP. As a nurse anesthetist, we're actually the first group of advanced practice nurses that are mandating the DNP for entry into practice. So I knew that within my position, I'm already doing some teaching, and I'm in a managerial position. So I knew that within my scope, I would be working with nurses coming in with their DNP. So I knew that was minimally what I wanted to get. And it wasn't until I came to this session that I really switched gears and realized that the PhD has a lot more to offer me, a little bit along the lines of what Dave said. I felt like clinically I already was at the level of a DNP, and while going to one of those programs may give me the letters behind my name and teach me more about how to evaluate research and analyze and review and critique research, I actually realized I wanted to do more than that. I wanted to learn that also, because I don't feel like I got a lot of that in my undergrad, but I also wanted to learn and be able to do my own research. And really, in a clinical setting, to be a principal investigator on a study as a nurse, you really can't do it without a PhD. You're always tagged to an MD through the clinical setting to get your own project going and your own research going. And so I also tend to, anytime there's a fork in the road, I tend to be that type of person that goes for the harder way instead of the easier way. But it really pays off more in the end, I think. And for me, I felt like, and plus I've met a few people along the way, a couple of nurse anesthetists that are colleagues of mine that actually have their DNP and are now doing their PhD. And so, to me it was sort of like, I'm just going to go straight there.
How come there's like 50% of you from Children's Hospital? Did you all get together and say, it's time, we need to do a PhD? Oh, I was just wondering, how come 50% of the students are from Children's Hospital?
That's a good question. Actually, in our cohort of 10? 9. We have 4 from, yeah, so it's almost 50%. I don't think we got together ahead of time. We actually didn't realize until we all sort of applied. But I do think it attests to our mentors in the hospital. And there were a few of our nurse leaders that in previous years, and they all actually pretty much came to UCLA and got their PhDs here. And so I know personally with myself, when I came to the information session and then I started thinking, actually PhD might be the road I want to go to, I started to reach out to those at Children's that have recently, in the past 5 years, gotten their PhDs also. And that, at least personally for me.
You applied earlier than
Yeah, I also reached out to some of the nurse leaders who've gotten their PhD, and it was something that I was pretty interested in when I was a MEPIN student. It was my second quarter, and I just knew I wanted to do research, but I didn't know when I wanted to enter a PhD program. But I knew that I wanted to get some nursing experience too before I started the doctoral program. And there's a lot of research support at Children's Hospital, and they support a lot of us PhD students or students in the DNP program as well.
So for me, I went back to clinical side because I miss it. I think you know for yourself if you're good at the bedside, you will always come back to the bedside. And then there came a time when I said, you know what? Let me try and apply and see what's the worst thing that could happen is they'll accept me. Oh shoot, they did. So now, now I'm knee deep into it, so I might as well finish. So that was. Plus, I wanted to do research pretty much from the.
You kept everyone smiling, I'm sure.
I hope so.
Okay. Hello, hi. My name is Anne. Some advice, if you could help me personally, I don't know if anyone else is struggling with the same issue, is that I have multiple interests of focus. And I'm kind of on the verge of, when applying, you want to reach out to certain mentors, and I know we can reach out to multiple and maybe interview with multiple to assess and have a better idea of what we'd like. Part of my, I don't know if you want to call it a fear, is to start the program and then later realize, you know what, I actually like this a lot better. I didn't anticipate this. So any advice about going about this?
Well, I started off in the doctoral program wanting to do research on medication errors in a pediatric setting, which later, and then I eventually I thought about it, and I kind of missed working with families and children. So I switched my dissertation topic to Latinos and congenital heart defects, but then my heart wasn't in it. And then I gave it much thought. I knew I wanted to do my research in families and chronic illness, and then one quarter I had an epiphany, and I wanted to work with children with families with autism spectrum disorder and Filipino Americans. So that happened in a span of about 2 years. So my research interest did evolve over time, but by the end of the day, I realized that's what I really wanted to do, and that's what my heart was in, and so it does happen to some students, like myself, but it's not the end of the world because you'll eventually find what your passion is.
Just don't close the ideas, your topics. Just write it down somewhere. Have a notebook that these are your secondary or your tertiary idea that you want to research, just in case the first one falls out or you can't find an advisor or a team that are willing to help you. Then you have another topic that you can fall onto. But my suggestion for now is pick the best one out of the 3 that you like, and then find a faculty that will match, and then you can move from there.
I would say, and again, we're in Vegas. I know Dr. Lee is here, but I think the challenge, and to me, it's the elephant in the room. So you come in and you really want to do a great job. You want to do what your passion is, but you're surrounded by these really academic giants who are giving you feedback. And you have to be really careful because they're not telling you what to do, they're advising you. And so you have to be really clear that where you're going. So if you're not clear where you're going, you'll get all this feedback and suddenly you're going down all these rabbit holes, and you just have to go back to what's true to yourself, because I think all of us came in with some notion from our clinical practice about what problem we were trying to solve. And so true to self and not being distracted by, because the faculty are going to advise you, but they're not telling you what you have to do. I mean, your chair, once you find that person, will be really clear. They're not going to let you walk off a cliff. So, yeah.
I was going to say that it's totally okay to come in with an idea and switch. I think in undergrad, people switch 2.5 times with their majors. It happens here too. But I would say what's important, you come in, that's something that's aligned with what you're doing already, what you have exposure to, because it's hard to like say, oh, I'm passionate about this, but then you don't really have context in that. It takes so much work, so make it easier on you. Come in with something that really aligns. You could write your idea as a concept map that we've learned in our program. Write things down, but see what really calls out to you. I think the other thing is, it is very difficult, but each class adds to new knowledge, new processes you learn. You dive into the literature, like initially, but then you learn about instruments in another class. You keep on adding. After 2 years, after you've had all the coursework, then you evaluate, really, is it something that you want to continue? But I think what helps us is we all picked something that we're still staying in. It might not be the research question we asked in the beginning, but it's within the phenomena where we still have the literature to support every work, every paper we've written. Now we're just going in more to the specific question we want to ask. So it is helpful if you can have a good idea, because then you build on it, and then eventually after 2 years, then you could ask the right questions. But I think if you come in at a loss, it's just going to be very difficult to go through, because you do build on it in the program.
Yeah, don't be harsh on yourself. It's totally fine to be confused, totally fine. So I came up, with different research interests, but, Dr. Lee and other doctor helped me to narrow my research interests. I consider, the tool, they consider the theory. There are many things that you have to consider during your study. So it's okay to be confused. That's totally fine. It's okay to feel like devastating sometimes or sad or what am I doing, But, after that, you will figure out your way, and everything will be like, with the advice from the professors, everything will be like easier and clear for you.
So outside of the PhD program, right? We all have to live outside of the PhD program. How do you make it work? I mean, family, kids. What do you do? A mortgage? What do you do?
I thought I can work. I thought I can work full time and go to school full time. I had to make sacrifice. I had to cut down on work in order to be able to juggle the schoolwork, and that was my personal and professional choice. You have to balance out. You have to give and take relationship if you want to progress throughout the 4 years or 5 years that they're giving you. You have to make sacrifices. So that's what I did. I dropped down to part-time and juggled. And it's challenging and it's doable. You have to have your self-control, self-determination, and you have to invest in yourself while you're in the program. Because if you get accepted, then you're in. It's from the day that you start that orientation all the way. They will help you though. They will remind you also that if you're going in different ways, they'll knock on your door. What's going on with you? Where are you at? They're very good about that one. So for me, I picked the path where it worked for me. So I had to cut down.
So good things also, it's really important to have supportive system, either outside of your, cohort or within your cohort. So I'm talking about my classmates. We always support each other, try to build this relationship, supporting each other, care about each other. So if you don't have that, support, outside, you will have it inside. So it helped us a lot, helped me personally with the stress. I'm an international student, no family here, so they're my family here. My husband is great, but he was so sweet. But you need, other also. He's busy with work and school as well. So, yep.
You should answer this.
Since I'm the only one with children. it's just everything that they're saying. It's a balance and it's a commitment. I'm working, I'm in school, I'm a mother, I'm a wife. My husband should probably be up here talking more than me because it's probably affected him more than it has. He's been the one to really pick up a lot of the responsibilities. And then I'll just say, you sacrifice from somewhere. And so I didn't have the option to go with my work hours. I definitely have flexibility in my work, which is nice. But so far as cutting total hours, I didn't have as much option. So it's more from my sleep and my own time. I have zero personal time now. All my what I consider my personal time, I spend with my kids. So, I've made that a priority. So late night evenings, weekends, I'm studying, I'm doing schoolwork. My kids are a little bit older, so it's nice because they're studying and doing schoolwork also. But it's, it's definitely you're pulling from somewhere. It's all a balance, but it's about priority. You just make it your priority, and this is what I have to do, and.
Can I add that you need to really evaluate your work and see if you have support systems at work, because that makes such a difference. And if you don't, you're going to suffer, I feel like. We want to be honest. Because work, if they're flexible, they are 100% behind you, they support you, then you can do this. Because it does take a lot of time and commitment. But if work is challenging, then you might need a new work environment to be able to do this journey, because it is a wonderful journey and you want to enjoy it and not stress about it.
I just would add ditto, ditto, ditto. Whether you're working or family or support friends or whatever, the dynamics change. So the PhD program will be the priority. There is just, otherwise you won't make it. The other thing is the people in your cohort become a new support system for you. And so that gets you through and sustains you, because your spouse or your significant other, whoever, they don't understand all this, nursing theory and all that, and nor do they want to understand it. So the people in your cohort become a new way of support. So, but the program is the priority, and just be really clear that, but go in with an end in mind. They give you 5 years, but you define how long you want to be here, and make really clear about, okay, I'm going to be here 4 years or 3 years or whatever, but you define it, and then be prepared to make the necessary sacrifices to get through.
So I have a follow-up question on this topic regarding finances, and specifically the school, whom I know is very supportive, and it sounds like in all ways, but in terms of because most PhD programs are known to be, you're not going to accrue $100,000 in student loans, and I just paid off mine, so I really don't want to take on more. But obviously, whatever is available for the school to help. So the question to you guys is, how easy have you been finding this? How much do you have to scramble to get the help, so that you may have to work less hours, or do you know what I mean?
So I'll start, since I have the microphone. I have a street corner I hang out on, and that's, no, I'm just kidding. I'm just kidding. Business has been really bad. So I have to say, I was really worried about the funding, because and it's Los Angeles, and I don't have a significant other that is rich and all that, so I make my own money. And the funding from work is pretty small. So the School of Nursing paid for the first quarter, I think, and then I was scrambling, trying to figure out, there are some scholarships that are available that are pretty easy, but those are, for me, have been small dollar amounts. What has sustained me, and it's added another layer, is I've served as a teaching assistant 25% of the time. It has been challenging, but it's also been on-the-job training for being in the academic setting. And trust me, I've taught classes, I've done lectures, but the teaching that happens in the academic perspective, because I'd never done it, is totally different. And so being a TA and working under the guise of some of the faculty has been great, but it's almost had like another job that you have to do. So, but that's how I financed it, is being a TA, so please don't take my TA position away.
For me, I work almost full-time during the summer, because then I can save money to cover, if I don't want a TA, just to give time to my writing and all that stuff, which is what I'm doing this fall. Is I worked a lot in the summer to cover the fees. There's always fellowship grants that pops up every now and then that helps out a lot. You know, even if it's just a certain amount of dollar, that still helps. But being a TA will pretty much cover your fees after you take the $499 and the $299D. That's after the fact, so that's what I did. I worked during the summer.
So during my first year, fortunately, the School of Nursing covered my tuition my entire first year. And then I started working as a TA, as many of us have done. And I was a TA consultant for about 2.5 years to help fund my education and get a valuable teaching and leadership experience. And most recently, I have a T32 pre-doctoral fellowship in vulnerable populations and health disparities. So we have monthly meetings about research in vulnerable populations, and they also provide us with a stipend so we can progress through their program, and we also have support. And there's also many scholarship opportunities you can apply for outside of the School of Nursing, such as professional organizations, and the Jonas Foundation also has funded some of the students here as well. So there is a way to fund your education. And I work per diem at Children's Hospital, so I have a pretty flexible schedule. So when I was taking my coursework, I could fix my own schedule. So if I had papers or a lot of things coming up during finals week, I'll take that week off so I can devote it to my studies. So for me, flexibility was pretty important to me.
Yeah, I would say actually even going back to the DNP PhD consideration, I mapped it out that actually the cost of tuition at this school for 4 years was actually going to equate to what it would cost me to get a 2-year DNP at a lot of the online programs that you may have looked at, and a lot of those programs are a lot more expensive. So straight up, it was going to be about the same cost for me. But I also feel like the funding opportunities in a PhD program are a lot more than in a DNP program. There's just by pure numbers, there's less nurses obtaining their PhD. And there seems to be, at least in my opinion, more opportunities for funding than were I to be getting my DNP. So between funding, I'm a recipient of the Jonas Scholarship, which has paid for my second year and is now paying my third year. And in the first year, I TA'd 2 quarters to pay for. I mean, the opportunity to TA is such a great opportunity, and it's something that you can do sporadically when you need it. It is more time and more commitment, but like Dave said, it's a remarkable learning experience too. I've taught classes and done lectures, but never been, the all-encompassing of what it goes on to really have a full class and all the different things that go on with that. And it's an invaluable learning experience. You're right there with the instructor, and they include you in everything. So that's been great. But again, it's also time. So like right now, I want to spend less time doing that, but I have my scholarship, which is helping. So there's a lot of opportunities, I feel like.
I would just add that being in a PhD program is financial. It makes more financial sense than undergrad degrees, than masters, because the funding, I feel like there's a lot of funding opportunity. I was lucky. I work here. If you work at UCLA, you get 2/3 tuition reduction, which is great, and it becomes affordable if you need to pay for the tuition. You can TA because it's 2 appointments in the system. They don't allow that, which is sad. That's a terrible part, but they're trying to fix the system. But I was lucky. I got the graduate or the Dean's Award the first 2 years, which is a full fellowship that covers the student, and they make the decision during the interviews. When you do get an opportunity to come interview, they look at the cohort and decide from the cohort. There's few fellowships they could give out. What's the other one that Tiffany got? Coda Robles, there's the Dean's Award. So few people from the cohort get full fellowships in the beginning. But then there are opportunities, like I applied for the Graduate Mentorship Award for my third year, and it's covering me the whole year again. And you get money. If you want to live on campus, you can. Even if you work, there are opportunities to apply for fellowships. And when you're at the dissertation phase, you can apply for dissertation grants. Again, it's a full fellowship that covers your whole year, all expenses, and you get like $20,000 to spend on your research or whatever you're working. So I feel like there are tons of opportunities. There's Robert Wood Johnson. There is like the Coda Robles. There are grants Sigma Theta Tau gives. There's a lot funding if you put your mind to it. Yeah, you'll be covered.
I'm just curious what your career goals are. That's the question I keep being asked by my family members. What are you going to do with a PhD in nursing? So I'm curious with your diverse backgrounds.
I went in thinking I know what I want to do, and now I'm like, don't ask me. I'm enjoying this. I'm going to figure it out. I went in wanting leadership positions. I want to be in leadership positions and influence health policy. That's my goal for the long term. And I want to be able to sit at tables with other health services people and be able to be reliable and accountable, and people trust me. I went in with that vision, but through the process, I've learned to be effective, you have to be well known in the research field. You have to be out there and maybe go into academia. People, I come with open mind, I would say that. There's so many options. That's what I've discovered. It's so wonderful to be going through this journey because there's so many options. I don't know the answer, but I know whatever I end up doing, it's gonna be fine, because this is the degree that's gonna get me there.
I think everybody should answer that question on the panel.
Yeah, so, yeah. Well, I will tell you, it wasn't, a doctorate isn't required for my position, and in some regards, I think it is not going to lend itself to necessarily moving up or doing anything different. But I went in saying that I wanted to remain in the service side, the practice side. And it's been an interesting journey for me, because now I realize that, and my peers can attest to this, that it's so busy in the practice, not that academia is not busy, but we're so busy in the practice side putting out fires and just getting the work done, that there is really no time to be innovative and to be research focused, unless you're in an academic setting, which is a pretty small part of people. So I have begun to see myself different in terms of my trajectory. I really do want to use my research skills. So whether it's a joint appointment at a school of nursing, or as a private, doing my own consulting business. So I think it's opened my eyes up that I don't necessarily have to stay in the practice setting. So I feel like it's helped me expand my thinking about how I can contribute, even at 54 years old. So yes.
I wanted to wake up the research mind of the people that I work with. That's why I wanted to get my PhD, because in the PACU of Children's Hospital, there's a lot of things that we can improve, but no one initiates, no one wants to do it, or no one has the right knowledge set or skill set to do a research. So that's what I did, and I'm like, I'll go back to the practice setting. And since I've done academia for almost 8 years, I said, oh, it's probably good to have my PhD also, just in case I wanted to go back to academia. So it's more of to wake up other nurses to be more research involved.
I'd like to enter a career in academia and become a professor in pediatric nursing. However, I'd still like to practice clinically, maybe about once a week, so I can still work with patients and their families, and at the same time have a research program of my own, as well as teach nursing students, because I find that very fulfilling, just to see these nursing students come in and walk the stage of Royce Hall. It just warms my heart.
Maybe I'm not realistic, but this is me. So I really want to go back to clinic. I love to practice my, to be an MD in women's health. And there were a lot of problems that I have seen in my clinic, the clinical practice, that we need to study it, but I don't have the skills. So this is the research in mind. And I love teaching so much. So I'm thinking about maybe full-time professor, but I would love to go back to clinic and also teaching and doing research. So this is my goal. I know it's complicated, and many people, they said that I cannot, I have to focus in one aim, but I don't know, this is me, so.
That's a little bit of my answer too. I sort of want it all. I feel like I already have, I'm in an administrative position, but I also do clinical work. Like my time is split between clinical, administrative. I do some teaching already. The only thing I don't do in my practice now is research. And I really felt like I couldn't break that barrier, and I couldn't get into that without my PhD. So I want to continue doing everything that I'm already doing, but also incorporate research somehow. I think eventually what I look at is I have children, I am, have at least 20 plus years of working and my clinical job as a nurse anesthetist is very physically challenging also. So I look at it as a transition that over the years, I'll probably do less and less actual clinical and more of the teaching and more of the research. But I also think it's an advantage to be teaching in a doctoral program to have your PhD. And a lot of programs, I think it's a good thing to look into, that if you're going to be teaching DNP students, some programs will accept the DNP to teach the DNP, but you're also sort of at that same level. And in EDD, I don't know if anybody's looked into the EDD also, if you're really interested in teaching, the educational doctorate is another degree that you look into, but there's already some talk that some programs will actually want PhDs to be to teach the at that level. So anyway, I want to do all four.
You are going to find people who are going to be surprised and shocked. There's a PhD in nursing. We get it on campus. Like, what? There's a PhD program at School of Nursing? What do you do? Like, they have no idea. So it's our chance to educate. It's really good, the role of a nurse scientist. You could use that term. I'm going to be a nurse scientist, and I'm going to contribute to the wellness and health of humans, or of individuals, of communities. And it's such a great place to be. So I think it's going to open up the doors for so many things that you do want to do.